Morning, everyone. It's lovely to be here. I'm just going to kick us off. So my name is Jill Mance, and my colleague that's with me is Katrina Hughes. So we're absolutely delighted to be here and honoured to win this award. Firstly, I want to acknowledge my colleagues who couldn't be with us today, Mara and Kevin. And it was Mara and Kevin who really led on this initiative, so congratulations to the both of them. I also want to thank Linda Craig in the PHA just for her support, and also all our stakeholders who have been involved in this project. So just as a way of introduction, just a background to the Belfast Trust. We are the largest trust in the UK. We deliver care to approximately 340,000 citizens. Our annual budget is of 1.3 billion. We have a workforce of over 20,000, and we are the major teaching and training hospitals in Northern Ireland. So as I'm going through and we're talking through a bit about what we have been doing as Feedback February, we will be talking about Care Opinion. So I just want to give a bit of background to Care Opinion. It is an online feedback tool for patients to leave their stories about their experience. So there's three kind of segments to Care Opinion. There's our story generation, where the public will publish their stories, patients about their experience. Also around responding, which is our services responding to people's feedback. And also the learning. And I guess for us, this is probably one of the most important, because this is where we're seeing the service improvement within our services and across our trust. So that's why the patient experience is so important to us to make these service improvements. So Feedback February. So what was the aim and what was Feedback February? What were we doing in this project? Well, it was a month-long campaign encouraging our patients and our service users to share their stories to help shape our health and social care. We wanted to raise the awareness of Care Opinion through Feedback February, so we really worked hard. We collaborated, we worked with all of our stakeholders really to promote this 1 month in February last. So the main focus then in February of 24 was to celebrate our staff and to focus on staff acknowledgement. So it was all very much about our staff. It was about how if we were to engage with our staff around our patient experience, around seeing the impact of the patient experience and what impact this would have on our staff, to raise our staff morale and to improve the staff experience overall. So the aim was around improving our services. We wanted to improve our services by improving our staff engagement, and this would all come from our patient experience stories through Care Opinion. So the patient and client experience team developed a number of activities. We wanted to highlight our staff recognition, and we also wanted to encourage the staff to engage with the feedback so they could really own the stories about their services, and really be proud of the feedback that was coming back to them. We wanted to see an increase in Care Opinion stories, and the increase in the stories and the feedback would show an improvement in our services. So in terms of the rationale for this project, we tried to look at a new approach to patient feedback, and that was with this focus on staff engagement. So we looked at a lot of research around why patients left feedback, and this was about recognising staff. This is why they left it, was to recognise their staff, was to encourage good practice, and also to signal good care to our other patients. There was lots of learning in the services, and it was also a tripartite approach. So the patients were sharing their stories, our staff were then engaging with these stories, and our leadership and senior management would be able to use this feedback and these stories and all of this experience to effectively to make change. And ultimately, that's what it was about. It's about getting the stories and making the changes in the service for the better good. So how we planned and delivered then on Feedback February, we have a small team in the Belfast Trust. It's a patient-client experience team, and they led on this initiative. There was a lot of collaborative working, so obviously we worked with our comms team, we worked within the services, we worked across all of with a number of staff, and also with our senior management. We had an engagement plan written, and we also tried to increase our visibility. So for the team, we're out and about, we were working working with all the staff across the trust, and we were trying to put out stands, roadshows, and really spreading the message of care opinion and of the importance of patient feedback. We held a number of training sessions, so we really tried to get that message out, train as many people as possible in care opinion so that they could then become responders to the stories. We were getting promotional material out, so a number of new teams who weren't aware of care opinion or hadn't been involved in it, we were really out spreading the message. We ran webinars with a number of staff about leadership, and we developed staff certificates. So where staff were acknowledged, when staff were acknowledged within a care opinion story, they would then receive a certificate to recognise them. And I'm going to pass over to my colleague. It's getting carried away there. Thank you.
So I suppose it was really important for us to be able to measure the impact of the project and to kind of see what the results were. We measured our impact by the number of staff who were using care opinion in terms of the number of responders that we had, the number of stories that we shared, and then our engagement with social media as well. We found that there was a 10% increase in the number of staff who signed up as responders, and that really came as a push to senior managers as well, as we feel that they have to own it as well within each directorate. We did see an increase of 300% in stories from February 23 to January 24, and this gave us a really good baseline in terms of future planning. We've seen an increase of 412% in page views, and we had 17 changes to services that were made or planned during that time. In terms of building this in the future, a number of improvements that we can share regionally as well. But as we have heard from Cheryl earlier, it's important to realise the impact of our staff engagement with the experience of our patients and service users, as Cheryl talked about, in our ecosystems of collaboration. And this really helped us then to keep the spark of the chemistry of all our connections. We've seen by Feedback February how staff engagement can improve patient care in a number of ways, and this is our plan in terms of how we move forward in the future. This includes patient safety, where engaged employees are more likely to adhere to standards such as simple things that sounds like sanitising hands and double-checking medications. Patient satisfaction, where engaged employees are more likely to provide personalised care, which leads to greater levels of patient satisfaction. Quality of care, where engaged employees are more likely to have a favourable view of the quality of care provided by each of our organisations. Things like resource utilisation, because we're all a bit strapped at the minute in terms of providers with highly engaged staff tend to make better use of resources. And then financial performance, in terms of providers with highly engaged staff tend to have stronger financial performance. So I suppose to summarise, then our impact is made, very importantly, by listening to the feedback of our patients and service users and embedding it into our systems. Thank you.